Ladies and gentlemen, good afternoon. Our final session of the day, which is going to be a rapid-fire series of 10 presentations from our guests from Canada. And if I may, I'd like to introduce Claudio, who's leading the group. What's going to happen is Claudio's just going to introduce the session. Then I'm speaking to all of you as presenters as well. If I could just have your attention for one moment. So after Claudio's done his introduction, each of you are going to have 4 minutes. I'm going to sit over there with my clock, and at about 3 minutes, I'll wave to you to let you know it's your last minute. Then you get 1 minute for questions. There's a clicker on here, and there's a microphone. And Adam's been reminding me, we need to keep the microphone pretty close so that we can hear you. Everything's being recorded so that you can use these for feedback and for future reference as well. So I'm absolutely fascinated to hear. I've had the privilege of meeting a couple of the organizations already. That's been absolutely fascinating. Excited to hear the other 8. But if I may, Claudio, can I introduce you, please?
Thank you very much. Again, thank you for joining us for this Spotlight on Canada. My name is Claudio Ramirez. I manage the Canadian Technology Accelerator here in London. Now, what is the Canadian Technology Accelerator? It's a Government of Canada funded program for some of the best innovators we have in Canada. And we usually do this in several streams. We have one stream in clean tech, which is actually very appropriate because one of the topics of this conference is about net zero and how can the NHS achieve net zero. And the other 2 streams are technology and life sciences, which we've merged together to create a digital health cohort. So we have 10 companies that have joined us, that have flown from Canada to come here and try to present their new technologies into the UK market. It's a very diverse group. They come from all across Canada. Some of them are minority-led or women-led. Again, it gives us great pride and privilege to try to introduce them. And honestly, we're here for collaboration and partnerships. Canada is an amazing partner of the UK. The UK is our 2nd largest trading partner, 2nd largest foreign investor, 2nd largest science and technology partner in the world. So we're looking forward to great things. Thanks again.
Thank you very much for the introduction. So the first company is Altis Labs, and I'm looking for Reid Lobson, the Chief of Staff.
Okay, thank you, everyone. Yes, as mentioned, my name is Reid Lobson. I'm from Altis Labs. We're based in Toronto, Ontario. Excited to be speaking with you today about how we're using AI to accelerate clinical trials. So I'd like to start by just calling out the massive opportunity that medical imaging represents. It is the richest yet most underutilized form of clinical data. If we take a CT scan, for example, it's a 3D reconstruction of the entire human body comprised of over 6 million pixels. And we've been collecting these and using them for decades in both clinical trials and in our standard of care. However, humans' ability to comprehend and quantify actionable insight from this is limited, and that's led to simplistic and flawed interpretation criteria. So in cancer clinical trials, we use tumor diameter measurement to measure treatment response. However, unfortunately, this is a poor predictor of the patient outcomes that we actually care about in cancer, being survival. So this has led to low clinical trial success rates, and bad R&D decision making by biopharmaceutical sponsors. So this means slow and expensive drug development. So at Altis, we can predict patient outcomes up to 79% better and more accurately using deep learning applied to medical imaging. So how we do this is we train models to look at the entire CT scan, so all 6 million pixels that I mentioned here, to find biomarkers that predict patient outcomes. So this not only allows sponsors to, biopharma sponsors to better quantify treatment effect, but also get these efficacious treatments to patients in need faster. So how we do this with a certain level of accuracy is we partner with leading research institutions to train our models. That's where we get the data access on decades of real-world imaging data. We then train the models on these and associated clinical data, and then we provide the predictive insight to the biopharmaceutical companies that are running these trials to allow them to accelerate their time to market. So here are some examples of some of the leading Canadian institutions that we are currently partnered with, and some of the high impact journals and publications that we've validated with. And then some of the biopharmaceutical companies, including Bayer and AstraZeneca, that we are currently working with. So how are we providing these insights? We're doing so on a imaging platform, a cloud-based platform. Not only do we show these predictions, but we also are providing our customers with 150 plus fully automated 3D quantifications. So these are organ segmentations and lesions that are all generated by our models. And I know I'm cognizant that I'm running out of time here, so I just want to sort of pull everything back together that I think what's different about us is we are focused on outcomes. So unlike, we're not trying to automate these legacy interpretation methods, we are trying to do predict what's most important, which is survival. And we're doing this with very rich data that I've mentioned before. And it has, what I'm most excited about is it has such a broad applicability because we use imaging for screening, staging in so many disease types. So I'll stop there.
Brilliant, Reid. Thank you very much. I'm sorry to be so short.
I apologize.
Not at all. So we've got a few seconds if anybody's got a quick question. If not, was there anything in your presentation you didn't get a chance to say you would have done? Say it now.
Yeah, I mean, I think the one thing is to just give some more scale to this that I was going to cover is using, if we can predict outcomes 50% better than the surrogate endpoints that are currently used, we could save, it won't let me go back, but we could save a biopharmaceutical sponsor over $1 billion in capitalized cost from phase 1 through to completion, through to approval. So that's something that I wanted to cover, but yeah.
Very good. Thank you very much indeed.
Okay, thank you.
Okay. And if I could invite, I think it's Andrea.
Hi. Okay. So good afternoon. My name is Andrea Galindo, and I am the CEO and founder of Baüne ecosystem. And what we're doing here is we are revolutionizing the way the healthcare system is accessed via remote health community and remote access to healthcare data in real time. So we know there is a challenge in general, not only in Canada, but in UK overall. There's rising demand, shortages in staff, and access to remote communities is very challenging. Now in UK alone, 1/5 of the elderly population has trouble or challenges when it comes to accessibility and movement for when it comes to their chronic disease management. And this is what we're trying to do. So the way we do it, you would think, okay, what is the solution? So the way we do it, we incorporate medical devices and IoT devices into one simple platform. We've been able to incorporate more than 33 biomedical data points and non-biomedical data points in real time. This is very useful when it comes to accessibility of care in remote locations and the elderly overall. And that's what we're trying to solve. We developed an autonomous care ecosystem where our solution for healthcare is called NUPA, and we have a preemptive decision system where the doctor can have access remotely to the patient's health, but also there is a score when it comes to accessibility and understanding of the health for chronic care management overall. Next. Okay. So as part of the solution, we incorporated many different medical devices. This is an example of our point-of-care station where the doctors and the patient can have an overview of their entire health on location, aside from information from remote data from wearable devices. This is an example of the type of data that you can collect. This is an example of how you can streamline the telemedicine with the remote devices on location. Now, in terms of the value proposition, we couldn't come across a solution without thinking these three parameters or these three important points. When it comes to the patients, they are empowered and informed, and they can have a better understanding of their health. When it comes to the clinicians, they have enough information to streamline and understand the patient health from anywhere, and they can have a better assessment or better understanding of the patient, thus delivering a better system. And now for the healthcare system overall, it's about incorporating and understanding how you can reach out to rural and remote communities in a more effective way. Now, I'm not here just to show my vision and what we have developed, but we're looking for partnerships. We're looking for development institutions and research and development institutions and opportunities to deploy our technology further, but also for investment opportunities. Now, I'm pretty sure that most of you have not heard about Baüne, but you can see from the partnerships that we have, we work with the Canadian Space Agency, and they trust their most precious people, which is their astronauts, for their health, and we work directly with them, but also on location, on Earth, we need to deploy the technology in another way. So I know this was fast, but it's a pleasure to meet you. If you want to talk further, and my contact information is in there.
Thank you, Andrew. Time for a quick question, anybody? Andrew, that was super quick. It's very difficult up here. There's a lot of background noise, and it's very bright lights as well. So well done to all our presenters.
Thank you.
Again, Andrew, we've got a few seconds. Is there anything in your presentation you didn't quite cover you'd just like to leave the audience with?
Well, in general, it's about how we can partner up and find opportunities to do further development together, and how we can get into the UK market, understanding the need of accessibility to healthcare in remote communities. So if you have a thought or want to discuss further, I'm happy to do so.
Great, Andrew, thank you very much indeed. Neil, if I can invite you up. If I can invite Neil from Calian Health, who's the Vice President of Growth and Strategy.
Hello, I'm from Canada. My name's Neil, I'm from Montreal. I went there and I stayed there, as you can tell by my accent.
And I'm Tasmin, I'm from Vancouver. We both work for Calian Health in the digital health branch, and we're here today to talk to you about Corolar. Corolar, oh, we went a little too fast.
Did I go too fast?
Yeah, that's okay. So Corolar is our interoperability platform that can help you underpin your patient journey through integrations in a seamless, efficient, connected way.
Let me introduce you to Corolar.
The world of healthcare is changing rapidly. Digital tools make it possible to personalize care for every patient, connecting every step of their journey. At the core of this connected experience is data, more data than ever before, from many different sources, such as hospitals, clinics, pharmacies, labs, and wearable devices. Too often, healthcare data is disconnected and siloed. This causes bottlenecks in patient care, errors, and missed data, and precious time lost. This is why the Calian Corolar solution was created. Corolar is a cloud-based interoperability platform that acts as a hub to connect data from different sources in real time. In addition to unifying healthcare data and workflows, Corolar powers a dynamic ecosystem of best-in-class digital applications for collaborative, patient-centered care. And Corolar integrates with any existing EHR, EMR, or source system, so you don't have to rip and replace your existing infrastructure. Calian is a trusted partner with a proven track record for creating a more connected and protected healthcare experience for millions of patients. With the Calian Corolar platform, your organization can continue to add new digital services and evolve as the world of healthcare keeps changing. Start building the right foundation for collaborative, personalized healthcare that can help you adapt and grow. Calian Corolar, your trusted platform for integrated healthcare.
All right.
So Corolar has many happy Canadian customers today. We've got quite an expanse from coast to coast, and we've moved into the US as well as to Abu Dhabi.
The Canadian health system, if you don't know, is very similar to the NHS, in fact, built on the NHS model. And we believe today we're bringing to the UK a Canadian success story.
So what's next? Well, first, after this, you can come meet with me and Neil, and we'll answer any questions you have about our systems.
Do you want to come to Canada? Come and meet our customers who have got this working really well. So we'd love you to come, otherwise we can always do a Teams meeting.
And then, let's make a plan. Overall, we will make that plan with you in a way that satisfies your ecosystem and your health institutions. The end of the day, this is not about a heavy infrastructure change. This is about the patient in your local hospital and how do we satisfy what you need.
Thank you.
Thank you, Neil and Tasmin. Any questions for them while they're here? So you're correlating effectively many streams of data from many different, and I can see millions of patients are benefiting from this, and you're bringing it all together so many people can use it. Amazing. Well, there's no lack of need for interoperability and integration, so I've no doubt the UK market is a right place for you to operate. Thank you ever so much for your presentation. And may I invite Adam Clay from Kognitiv Spark, Director for the UK office. Thanks, Adam.
Ladies and gentlemen, very good afternoon. Adam Clay, I'm from Kognitiv Spark. We are a mixed reality software company. The device on my head is Microsoft's industrial-grade mixed reality device. It allows you to blend your digital world with your real world. And we do that in a number of ways. Imagine for a moment that any content that you share typically at the moment, or you access via a phone or a tablet or a desktop, can appear in holographic form where you need it. And the beauty of these devices is you can use them hands-free. So by using a number of vocal and gestural commands, you can interact with that content. What we're also able to do is using the camera that's set in the front of it is see what the wearer is seeing. So our starting point with this tech was really around how do we keep operational tempo in an industrial setting. So I'm a skilled technician. I've encountered a problem with something, but I need to seek assurance from somebody who's on a desktop anywhere else in the world. That was our starting point. And we've started to scratch the surface now in healthcare. Two scenarios here to consider in how it works. A patient at home. And I'll go on to a case study in a moment, but then they're needing some wound care. You have a community nurse or health professional who's in their home who's going to be doing that. But they just need to seek the assurance of a wound specialist back at a hospital or wherever they may be. The health professional can put the device on, connect, establish a secure audio and video feed, and they can actually talk them through the procedure. We've moved it on now to this second image here. You can see these are digital pins. So you can populate your workspace with content that's going to be useful to help you solve a task. So this piece of equipment, you may have used it before, but it'd be kind of useful for you to draw down on the operating manual, the procedure, the startup, whatever it might be. Well, using the device, you can click on that information. It opens next to the machine where it actually is, and you can have that sort of self-serve learning element to what you're doing. If you need to contact the person in the other part of the hospital that knows more about that than you, well, you can connect through with a call. Quick case study, thinking about that, is the work that Charlie, my colleague here in the front row in yellow, is doing with the New Brunswick Extramural Program. We have our technology deployed with their community nurses right across the province. The province itself is geographically vast. You've got, and what they're using it to do is better patient outcomes, treating people in their own homes by using our technology. Specifically, we mentioned it a little bit a moment ago, complex wound care, meaning that patient doesn't have to travel to hospital to get that care that they need. Thank you. Thinking specifically about the UK opportunity, this was just one thread that we pulled out from the NHS's long-term plan. 1/3 of face-to-face appointments delivered in outpatient care to be avoided by 2024. That doesn't give us very much time. We're part of that solution, is what we feel. And you can start to see some of the impacts on the numbers if we're able to achieve that by using this sort of technology. Continuing on that theme, we've talked about in-home and domiciliary care. Well, what about ambulance services and blue light? On the scene, putting on this technology, linking through to a specialist, really helping with something that we've seen so much in the UK at the moment. How do you, on that triage, how do you stem the flows between accident emergency or these urgent treatment centres and community health and district nursing? In this country, we have a population quite often sometimes remotely located. They can't travel to get the care that they need. How is this technology going to help them do that? Oh, that's me and Charlie.
Thank you very much indeed. I love the use of the technology, but also the practical contribution it can make on an annual basis, both financially but very practically. The speed of delivery of care. If you're an ambulance that's arriving and you've got clinical support back at base, they can just spread that resource much better.
Accessing expertise wherever it is.
Fantastic. Any questions? No? We're getting into a theme. We're on a roll, aren't we? Great stuff, Adam. Thank you very much indeed. Excellent timing. So, if I may, Mobia Health, Nevin Pick, President. The floor is yours.
Yeah, thank you. I'm Nevin Pick. I'm the president of Mobia Health. We're a technology that improves the appropriate and the wait list, better managed wait lists for acute care. And as we know, the acute care patient journey needs to be untangled. And if anyone has had loved ones or yourself go through acute care, I think that it's a reality that the point between yourself and your outcomes is a maze. And that maze is building a challenge around how you're able to navigate through the system that creates additional wait times and challenges around the acuity of a patient receiving their care. And the highest challenges we've seen are not enough staff. We need to be able to have more staff to be able to handle the increased demand on our system, which is now increasing longer wait times, which is all being impacted by aging population. So our solution, instead of taking this to a generic wait time, we looked at something that was very acute, that's something that was very complex to really change how wait times are being delivered. And so we looked at cardiology as a core acute care pathway to look at solutions. And what we've seen is wait times continue to increase. Over 7,000 people in the UK right now are waiting over a year for their treatments. And in our foundational customer in Newfoundland, we've seen catheterizations have a high inappropriate rate, where we're having a lot of catheterizations being delivered that may not have been needed. And we're seeing those wait lists continue to increase, so more and more people are on these cardiac wait lists. So by using our technology to be able to better understand what the acuity level and what the appropriateness of patients through their clinical decision support and our intelligent referral, we were able to reduce the wait list by 37% just by making sure the right patient gets the right treatment at the right time, all while automating how that process works to improve automation and making sure that the patients are prepared and show up, making sure that facilities use the best time that's available to make sure that the times that are allotted for the patients are being used. But cardiology is only the beginning. Being able to use clinical decision support and risk stratification to make sure the right patient receives the right care at the right time, and being able to have that all into an acuity-based schedule and automating processes, cardiology is a great place to start as one of the challenging treatments that acuity is so an important part of. But we're quickly seeing that orthopedics and endoscopy are quickly behind, with those wait lists continuing to be a challenge and growing. So if we're able to navigate through those, we're having a huge benefit on the outcome of patients and making sure that more people are being able to be seen with the existing resources. We've had a number of successes in Canada. We have a lot of support from federal government, and we're part of a technology company, a spin-off of Mobia Health from a large technology company, Mobia, that is providing our technical services. And our key takeaways are that we have a strong and experienced team with technology with proven outcomes. And now we're here in the UK looking for opportunities to pilot our technology and understand if our outcomes we're seeing in Canada have appropriability to cardiology in the UK. And we're looking for investment, so to continue our journey with R&D and to be able to help enter new markets. So love to talk to you. Have any questions, feel free to scan my QR code, connect me on LinkedIn. I'd love to be able to continue the conversation. Thank you.
Well done, Nevin. Thank you very much indeed. Very impressive results, bringing down all of those unnecessary catheterizations. And that's exactly the sort of thing we need all over the world. Certainly in the UK, when we've got 7 million people in our waiting lists. Any questions? Okay, moving straight on. Nevin, thanks very much indeed. And if I could invite Bronwyn from PragmaClin. Bronwyn Bridges as CEO. Is that correct? Did I pronounce that all right? Oh, okay.
Hi, everybody. My name is Bronwyn Bridges, and I am the CEO and co-founder of PragmaClin. We are a digital health company based out of Newfoundland and Labrador. But before I tell you a bit about where we are today, I'd like to introduce you to Gord. He was an avid runner his entire life until his 50s, where he noticed gait and slowness occurring. And also, I realized the formatting is off. Apologies. But then he decided he wanted to go finally seek help, and he was told it would be a 1 to 2 year wait time to see a neurologist. Gord now was diagnosed with Parkinson's disease, and we decided to co-found PragmaClin to help combat this in rural Newfoundland. Gord is also one of the 10 million people who have been subjectively diagnosed with Parkinson's disease and is only seen once a year for follow-up, and as well does not have access to a movement disorder specialist, resulting in less than optimal care. So we decided to create a real-time clinical decision support tool that would be able to provide real-time motion capture assessments from within the clinic that would be able to then show comprehensive, accessible data and notifications for clinicians, and patients to better manage the symptoms between appointments. We also have algorithms that are able to alert the clinicians or the patients, or even other caregivers and general practitioners, to any rapidly changing symptoms for trends so that they can adjust physiotherapy or medications more frequently on an individual basis. But we also wanted to be able to support the patient and the caregiver in between. So we created an application that does weekly surveys from home that are completing the other pieces of that international standard. So you can track medication, sleep, cognitive function, and more. And it uploads it to the same portal that these clinicians, physios can all see as well. What makes us different from the Parkinson's assessments that are currently out there is that we're actually using those 3D cameras in a special way that can provide a real-time assessment, so we don't require a follow-on assessment by a neurologist to be completed, in that a neurologist is actually able to just look at the data and then make their own decision treatment there on the spot. We don't have to send any videos back, and this provides a more accurate assessment as well, instead of using 2D cameras. Currently we're using trial participants that are then turning into procurement opportunities through hospitals and healthcare institutions, then moving and scaling into pharmaceutical companies as well that are doing phase 3 clinical trials on new drug discovery, while housing the IP and the data within our company to then monetize on that database as well later on. Currently in the markets that we're seeing, we're selling as a subscription plus our hardware, which now looks like this as opposed to the first slide that you saw, and we're selling this on a contract model of software subscription. So far to date, we've managed to leverage $1.5 million in non-dilutive government funds from the Canadian government and other institutions that has helped us to develop our MVP and scale out our team. as well as secure trials. I'm sorry that all these blue boxes are looking a little silly on this slide, but the trial that we launched in Dubai just completed. We also have partnerships here in the UK with King's College, in Canada, and in the US through Maine Health. We have also 2 usability studies we've completed and a paper for publication. The team grew from myself and my co-founder to an amazing team of research, software development, business development leads, and regulatory affairs personnel over the past year and a half. And we've also scaled some key opinion leaders in product development, digital health space, as well as Parkinson's specific, including Dr. Ray Chowdhury, who is the #1 Parkinson's doctor in the United Kingdom, as well as #4 in the entire world. He has been able to champion us across the globe and is a massive supporter, saying it will help to optimize his treatment strategies and provide better end-to-end care. So we're seeking partnerships and investment, and the investment is to help support the clinical work, especially here in the UK with our partners that we already have. Also, this was just a list of all of our amazing awards we've gotten over the past year that have helped us to get to where we are. And welcome to PragmaClin, where the future of movement care starts at home. Thank you.
Brilliant. Amazing how somebody's turned a challenge in life into an amazing opportunity, and congratulations and best of luck to everything that you and Gord go on to do, because that's a huge challenge, and I'm sure that the technology that you're using can be applied to others similar disorders. Wow, it just gets better the afternoon, doesn't it? Any questions, anybody? Great, Bronwyn, thank you ever so much. Now, this is handwritten, so I'm not sure I'm going to pronounce it right, but I'll do my best. Can I welcome Elijah? Is that correct? No?
Hi, everyone. Good afternoon. My name is Ali Reza Dawoodi. I'm a co-founder and VP Research and Development with RxPx. And the mission we are in No Patient Alone. So RxPx is a global SaaS platform that is built specifically for the needs of life science organization. We make life easier for patients, caregivers, and the HCPs. We are available in 100 countries and available in 12 languages. We have headquarters in all around the world and here in the UK. And here are some of the great brands that we work with them globally and in the UK. So here are some of the global challenges that we solve, which also apply to the UK. So medication non-adherence. So we all know that a high rate of adherence is needed in order to achieve the expected health outcome. The HCP workload and the patient backlog is an ultimate pressure on healthcare system and HCP to bring the patient faster into the therapy. And also with the raise in investment in digital health, we can help with tracking your return on digital health investment. With regard to that, these are some of the challenges that we see in the UK. Currently, there are 130,000 MS patients living in the UK. And the concerning news is that the MS patients in the UK have the lowest rate of adherence compared to the other MS patients in EU. And also, every single week here in the UK, 130 new patients is diagnosed with MS, and this adds even more to the burden of the HCP and healthcare system. Move on. And this is how we solve the problem, basically. So RxPx is a personalized, scalable adherence support platform that makes a difference every day. So it's an end-to-end patient management solution for the entire journey of the patient. So it comes with an HCP portal and a patient portal. So the patient portal is our community care solution, which use AI and machine learning to meet the patient where they are at their journey and provide them with the support and the services they need. The HCP portal help the HCP to bring the patient faster into the therapy. And the ecosystem is integrated with some other components, such as the nurse module, the online pharmacy, and the lab. So here's a recent case study that we did with the government of Canada and with one of the health authority in British Columbia. So we deploy a community care solution for expecting parents that might be going through the C-section process. So in order to offload some of the burden of the HCP and the healthcare system. And this deployment happened to be successful with 79% engagement with the content and the program and the 64% daily and weekly active users. And here are some of what other people, like ex-CPN patient, talk about us. Every 3 minutes it takes to enroll a patient, it saves 3 hours. Or it's overwhelmingly comforting to have people understand my day-to-day problems and struggle that no one else basically does. So RxPx, founded by doctors and physicians and technology leaders and shaped by patients. We deploy globally, but of course we work with you locally to tailor to your organization needs and requirements. We have our headquarters in London for a while, and we are looking for a new opportunity, new collaboration, and new partnership. Thank you.
Good. So you say you're headquartered here, or you have a UK headquarters now? Okay. And how long have you been here?
It's, I guess, over a year.
And
Yeah,
have
we
you
are, of
found
course,
it?
expanding.
Have you found some traction?
I think so. Our business development of UK is going to be here tomorrow, so she will have like a more data and stats, of course. Yeah, like last year we had a visit in UK, and it basically we ended up with 2 collaboration, and we are going to have like working with 2 UK company. So of course, we see some traction over here.
I think one of the things certainly me and some of the other mentors have certainly been advising is you do need to be someone needs to be based here and living here and permanently working. It just advances the opportunities so much. And I know some people are thinking about stepping in, but it actually needs just somebody who's totally focused on it. Well done, congratulations, and I wish you well with the journey.
Thank you
very much indeed. And now it's my pleasure to welcome Skinopathy, Keith Liu, co-founder and CEO.
So Skinopathy was founded during the pandemic to solve a very real problem for our patients. And that was many of them were suffering, some even dying from skin cancer. And so in the past 3 years, we had to build, and we had to build fast. And over the past 3 years, we actually had a couple of things that we built that would have been deemed globally unique. And I'll share more of that with you shortly. But we truly believe that every patient needs to receive the right treatment at the right time from the right doctor. And so in order to do so, we need to make sure that we address the entire continuum of care, and we'll show you what we do. Perhaps what the world knows most about what we do at Skinopathy, of course, is our AI. We have the world's only 3rd-generation dermatological AI that can screen for any skin condition on any camera with real medical relevance. I know that's a mouthful. This technology has been heavily validated across the medical field. We've presented, podiumed, and published at 40 medical conferences, and we've won quite a few awards along the way. But most recently, it was at the Canadian Society of Plastic Surgeons, where we won Innovation of the Year. But for the data scientists in the room, perhaps you'd be interested in this. The Responsible AI Institute actually designated us as the only dermatological AI in the world that's doing it the right way, which is why they have partnered with us, Memorial Sloan Kettering, IBM Research, and others to build a global standard based on our AI. And they even nominated us for AI Startup of the Year in New York. But AI is only useful if you put it in the hands of people. And so our second suite of technologies that we have, we call it engagement tools, and engage patients we have. In the past 2.5 years, we've had over 650 doctors refer over 15,000 patients to use our technology at our clinics, and it's worked quite well. But what I'm personally most proud of is that the Alberta Firefighters Association just granted us an award to fund our technology, but also to use our technology for firefighters, burn patients, and burn units. But perhaps the part of our technology that most people are excited about is actually our data platform. So we have the world's only real-time, real-world data-driven dermatological EHR with AI and automation built in. In short, what we have done is captured the entire dermatology journey with extreme data granularity. And this has had dermatologists around the world deem us one of one. So let me tell you a bit about the company. My co-founder is a plastic surgeon with about 120,000 patients. Been doing this for 30 years. He's been building this tech for about 15 years. We essentially have taken his technology and modernized it and added AI. Myself, I've been in tech for about 20, 25 years, from startups to unicorns to large tech companies. We have a leadership team that are, well, world leaders in what they do, MD, scientists, engineers, And they are supported by another 30 or so people, MDs, scientists, engineers, including the former president of the Canadian Medical Association, former chief privacy of Ontario, et cetera, et cetera. If I can leave you with one thought, and that is we truly believe that every patient should receive the right treatment from the right doctor in the right time. The UK is strategically important to us because the UK was the first country to actually approve the use of dermatology AI, which is why we filed our patents in the UK, and we're looking for collaborators to expand here. Thank you so much.
Congratulations, Keith, on pulling all this together in an incredibly short space of time. I remember the first solution here, and it was probably only, what, 2-3 years ago, I think?
I think it was a few more than that.
Well, I know when it started, but when it started to be used, it was probably about 3 years ago, because I was working with a company that was doing it then. For you to do this at such pace compared to that company that's got that level of resource, I really do commend you and all that you're working on. And it takes the technology to the patient as opposed to the patient having to come into. So there's such a shortage in this country of dermatologists. There's no way we can train them fast enough. And frankly, there are some parts of the country that people just don't want to work in. So it's been something that's been a shortage of for a long time.
There are typically 1.9 dermatologists for every 100,000 citizens. That's why there's such a big challenge.
Well, look, any questions for Keith? That was a very, very good presentation. Thank you very much indeed, Keith, and good luck with all that you're doing. So we're down to our last couple of presentations, and Clement, from Smile CDR, co-founder and head of corporate development. Clement, it's great to see you.
I'm Clement. I head international business expansion at Smile Digital Health. I'm here with my colleagues, Derek and Duncan. And why are we in the UK? Well, UK, not unlike any other country we've been to, the demand for services far outpaces the supply of services, health services in those countries. And that's simply part of economic development, and it's also not a tenuous situation, right? They have to find sustainable ways to keep up, and frankly, digital transformation has to happen. Otherwise, the current status quo will not survive. And the good news is, in the UK, you do recognize that digital transformation has to happen. You do recognize the value of data and automation, and that's a good thing. The bad news is, all this data sits in fragmented systems and data silos. How do we get them out of that and put them to work? The good news is, the NHS has initiated a project to extract data from these silos and make it shareable. You know what I'm going to say next, right? The bad news is, well, since they announced the award of the project to an American company, there's been a public outcry, primarily around the concerns of trust and what you're going to do with that data, who you're going to share it with. And that data has value. Apparently, somebody gave me an estimate that it's worth $10 billion just for the research insights alone. Well, here's the good news. We're Canadian. Better than that, we actually have a solution. And that solution is basically an enterprise data management platform that we've been using and delivered and we've deployed in multiple countries over the last 7 years. And that enables our customers to better ingest, transform, store, enrich, and share that data with others. We believe that that's a digital transformation that has to happen to make that data available to the right people at the right time, right? So that you can actually use it to improve the healthcare system. And we call that health system, or that approach, a health data fabric, right? It's going away from people being able to, having to integrate every time they want any piece of information, to freely transacting that data. And the critical differentiator in all that is the storage of that data. If we can transform and store it in an open standard that other people can understand, come and get it via APIs. That's the part that's not happening in industry. At least we're part of that catalyst. We hope to be a part of that catalyst to make that change. In Ontario, they've been spending the last 14 years building out these repositories of data. Anything from labs to diagnostics to prescriptions and even your health records when you visit hospitals. They all exist in different repositories today. Every health episode of every citizen engaging in our health systems results in multiple records being stored in multiple places. And nobody has a clue what that one single record looks like. It doesn't exist. If they tried to do it, it'll just simply cost too much. Look at all the different integration points. Cost too much, take too long. Nobody can get value out of that. So what we've been doing in Ontario is that we've been brought in to replace all these legacy repositories with Smile underneath, with this new architecture, with a standardization of data so it can be easily shareable. Okay? And what we're looking to do is, once we complete all this, we want to make that data available, consumable, via standard data protocols. Simplify it. Stop making everything single points of failure. Just talk to a simple data tier above, and you should be able to get that data. We do the hard and heavy lifting there. Smile's been around for 7 years. I'm one of the co-founders. We've been deployed in 21 countries. We're learning as we're going. A lot of lessons there. We have about 300 employees. We have one customer in the UK. I'm here to find out what's going on and position ourselves so that we can address the market needs. Our go-to-market in the UK is an indirect approach. We see ourselves as the core building block of any solution, any interoperability solution, any solution in any digital transformation solution. And we're here to look for like-minded partners, whether they're resellers, implementation partners, managed service providers, to target customers such as ICBs, localities, hospital economic units, so that together we can make the right data available to the right people at the right time and transform the UK healthcare market. Thank you.
Again, a great presentation. I mean, Clement, we've had a chance to have a chat before, so I had an idea of what you've been doing. There is no doubt of the needs for these solutions. And, you know, HL7 Fire is a big old platform, but I think it's a really good, broad solution. And I think one of the concerns I've kind of got for the market is it ready for not just you, but your other colleagues that are here today? Because so often people are actually stuck with, interoperability still got to be sorted and we've still got to do standards. But actually, there's some amazing solutions, many of which we've seen in the last hour, that can just advance. I think one of the single biggest challenges both you and innovators have is getting people to believe it can be done now. And that's what you've shown. That's what you've done at incredible scale. And again, I commend you and congratulations on all that you do. I hope you find some partners. I'm very interested in what you're doing. Any questions for Clement before he finishes? No? Okay. Clement, thank you very much indeed.
If I can add just one thing to
Please
that,
do.
Shane, it's not about HL7 Fire. It's about standardization. And we have to work with what's in the market today.
Right.
So point me to where the data is. I'll bring a team, use our technology, bring that out. But once we bring it out and transform it into Fire as a data model, it's consumable from there on. There's no vendor lock-in. There's no further transformation. That's the beauty of it. A lot of times people come to me and say, can you solve these 12 problems? And I go, I could, actually. If you put me on top, I'll solve 8 of them right away. But people don't think in that way. They look at new solutions to fix legacy problems. So that is the mindset we really need to get around.
And I think that mindset applies to so many other things. It's about people maybe just stopping about not just on their problem, but hang on, what else can we do here? And I think that's, it's an opportunity for moderators like me on platforms like this, and it's for everybody to try and broaden that conversation, because actually we can take care of the individual component parts, but we can contribute to the whole as well. Clement, thank you very much indeed. I have one more person on my list who wasn't here earlier. So can I just check if Jean Manas from 360 Medilink's here? Jean, you're very welcome.
Hello, bonjour. Since the impact of COVID, everyone has heard about telehealth, telemedicine. Nowadays, there's a new category called digital medicine. We at 360 believe that this can have big impact for better care, quality, but also better health equity. In the UK, infant and maternal mortality is about twice higher for Black and Asian women versus the general population. If we look also closer, whether it's in cardiovascular, there are more and more conditions that way. If we look at the population, there's about 15% of, I think you call it BAME here, Black and Asian minority populations here, and over 70 languages spoken. So healthcare disparities are real, but also those special populations need special care. This new category of digital medicine, in it you can find the digital therapeutics and also software as medical device. This is what we do at 360 MedLink. We offer two kinds of solutions. First one is a treatment companion, which we'll show you in a second. And ultimately, this helps improve care quality and the care experience for patients. So our first solution clinically, actually the original name was TAVI, but this is based on virtual coaching and helping the self-empowerment for patients, of self-efficacy. So this is disease agnostic, culturally adapted, and also easily expandable. It helps on the patient support and also in terms of remote care management. I don't know if you see my video here, but these are pre-recorded little videos that plays and then with call to action for patients. The approach is very holistic, so it combines three main segments: the engagement portion, the support, and also the gamification or the light portion for the patient experience. So this has been clinically tested. We have delivered obviously good data and delivered in different therapeutic areas, both in North America and in Europe. So whether it's in HIV, psoriasis, cancer, melanoma. We have experience working with pharma biotech companies, agencies in the US, health agencies like the state of Rhode Island. We have other partnerships. We have been nominated for multiple awards and recognition. Ultimately, we're here in the UK looking for strategic partnerships. We'd like to step foot here in the country. We also welcome friends and also new clients. I could show you a few more slides in terms of data results, but this is only a 3-minute pitch, so I'll stop there. But you can see from HIV in the US and now psoriasis here in France, well, here next door in France, sorry, and so on. I'll stop there.
Got a minute or so left if you want to keep going.
All right. Well, this slide doesn't show well, but also there's a lot of data, in real-time data tracked from the patient usage. And this is ecologically taken, so we're able to see what they're doing, what they're not doing, what type of therapy, and also sessions that they're going through in terms of education. And then we have a digital health ecosystem, we call it, because patient alone doesn't resolve 100% of the problems. So whether it's a caretaker at home or paid caretaker, professional, but also the sponsor who's paying for this wants to see return on investment, wants to build real-world evidence. So our digital ecosystem allows to do all that simplistically. Voila. Thank you.
Well done. Those 4 examples that you gave us, was there a reason you started with those 4 in particular? Or is that just to demonstrate the breadth of the capability?
These 4 actually already...
There you go.
These 4 are already executed, so implemented. Actually, the HIV one's been for 7 years now with Rhode Island. So I think it's easier to talk about things that are already implemented with good results, and then we can scale. But the platform is SaaS, therefore we can go into any pathologies quite easily within 2-3 months, just putting the content and then adapting languages, ethnicities, and so on.
I mean, an example that you used about, the population of Black and ethnic minorities. I mean, a couple of miles from here in East London, there are over 200 ethnicities, and there aren't 200 countries on the planet. It is really, really complex and dense in so many other areas. And you're right, the disparities are not just the examples you're there. They are quite the way across. And of course, the movement of people over the last few years, not just in the UK, but all around the world, means that actually things are becoming more complex. Again, I commend you on your work that you're doing. It's an incredibly valuable asset for all of us, and I wish you well here. I'm going to assume there's no questions because this is the last presentation. But look, thank you very much indeed, to not just yourself, but to everybody. It's quite a pressurized environment in sort of 4 minutes to try and present. But if I may, is there anything in your presentation you didn't get a chance to say? Just the floor is yours for the last sort of statement.
Yeah, maybe one last thing, because I went pretty fast. It's also the social determinants of health, how important they are nowadays. And through COVID, we also saw that it's not only about ethnicity, but also in terms of different populations. The vulnerable could be elderly, they could also be young, so it's really adapting to the special needs. Yeah.
And that's fantastic to hear. And we did speak earlier in the day about the social determinants of health, like really the poor relation in all of this. And we're often looking to treat a disease, not a citizen who has multiple comorbidities and complexities, that actually come back to the social determinants of health. And I think the challenge over the next 30, 40 years is that we need to start at the other end and sort of work backwards. But it's going to take a generation. But again, thank you very much for coming today. Thank you for your work. Number one, it's really difficult to get your message across in 4 minutes. Number two, it's a dry air environment and there's a lot of noise there. So look, congratulations to all of you. Thank you very much for your patience as well for sitting through this. Claudio, do you want a last word at all, or no? Well then, look, thank you ever so much for being so kind with my time calling, because I did feel a bit brutal at some points. Thank you for your explanations and the effort you've put into your presentations. And look, I wish you well with the rest of the tour for this week. I hope you all find your partners and investors. Certainly, you've given us a lot to think about this afternoon. Enjoy the rest of your evening. Thank you very much, everybody.